Hello again, this is part 2 of our anterior abdominal wall series, and in this video we're going to get a deeper and more solid foundation of the inguinal canal and its contents. We are back much more superficially. These are your superficial inguinal rings. They are not always this obvious. What I'm going to do now is I'm going to talk about two different scenarios on two different sides. On this side, I'm going to add a scrotum, and on this side, I'm going to add a labia majora. So we're going to split this right down the middle and do both scenarios. And I'm going to say this is a scrotum, half a scrotum, I should say, and this is a labia majora. This side is going to have testes for gonads. This side is going to have ovaries for gonads. Two different scenarios going on here. There are variations in between these two different scenarios. I just don't have time to talk about all of them. We're just going to separate by what type of gonads do you have? The reason I bring that up is because if you have testes, it's typically easier to find your superficial inguinal ring because there's a larger structure in it and coming out of it. So I'm going to draw in that structure now. If you have testes, there's usually something taking up the entirety of that opening that is cylindrical, that's coming out of the superficial inguinal ring. And that structure is the spermatic cord. Now the spermatic cord is many structures. It is not just one structure. It is layers of fascia, a muscle, and it's artery, vein, plexus, and nerves, and a structure called the vas deferens that is the transporting tube for sperm. So this is a lot of stuff. We're going to call it spermatic cord. It is sheerly easier to find because it is a larger structure than what's coming out on the ovary side. Since ovaries do not descend into the labia majora, ovaries stay internal, and I will explain why. We have a different structure coming out on this side, but it is going to the same equivalent place. When you are a fetus, you have what's called a labioscrotal swelling. You don't have just labia or just scrotum. You kind of have a pseudo, maybe it's going to be this, maybe it's going to be this scenario going on. There is a structure that is a remnant structure that I'm going to put in pink on this side as well, that created the inguinal canal itself. And the structure that created the inguinal canal itself is called the gubernaculum. And we are going to do a little bit of embryo so this makes sense. Alright, so we are going to go through, once again, this is our ovary side, and this is our testes side. And this is development. So this is a little fetus. These are legs, abdomen. And you can see this structure in pink is your gubernaculum. Your gubernaculum is a weird structure. It is gelatinous, ligamentous, and it's like an anchor. So imagine this eraser is the gonad. So this is a gonad, and this is a gonad. That's what we call them before we call them testes or ovaries. When they're kind of ambiguous, we call them gonads. So these are two gonads, and if this is a gonad, my eraser, the gubernaculum is like grabbing it, and it is anchored down in what we call the labioscrotal swelling. And what it's going to do as you develop, and this is happening as other things are happening too, you're getting longer, you're getting more organs. As all these things are developing, the gubernaculum is shortening. And because it is shortening, it is pulling that gonad down while you are developing. On both sides. Ovaries, testes, doesn't matter. Gubernaculum is pulling down. So what's happening on the testes side as we develop is this is actually moving down too. So this guy's going down, gubernaculum's getting shorter, pulling down. Maybe our scrotum is developing a little bit more, pulling down. Cryptorchidism is when your testes doesn't end up inside of the scrotum. It's somewhere along this path. This is why the gubernaculum doesn't always shorten properly. And as it's pulling down, we are going to go through, because this was intra-abdominal, essentially. It was inside of the abdomen. And to get outside of the abdomen, which has an abdominal wall that we haven't really gone through fully yet, but it has layers of an abdominal wall. It has to go through all of those layers. Your testes being pulled down, dragged by your gubernaculum, is going to go through every layer of the abdominal wall. So it's going to go through, except for skin, it's going to go through your external oblique, your internal oblique, your transversus abdominis, the transversalis fascia, and the parietal peritoneum. I know we haven't gone through those layers yet, but we're going to get there. But it's going to go through every layer. So every layer of your anterior abdominal wall actually surrounds your testes as an adult. And you learn those layers, and they have different names, and we're not going through them right now, but we're going to pull through those layers. And I want to make that clear to anchor the testes into the scrotum. So the gubernaculum, when you have testes, still exists. There is a remnant structure. We call that remnant structure the inferior scrotal ligament. So if you are a person with testicles, you have an inferior scrotal ligament that is a remnant of your gubernaculum, which created by dragging testes through your anterior abdominal wall, the inguinal canal. And so the inguinal canal is kind of a remnant structure from when you pulled them through your abdominal wall. It's also why your spermatic cord, if you have testes, goes through the entire inguinal canal, because testes need to stay alive. And when you are dragging them down through the anterior abdominal wall into the scrotum, you have to bring nutrients, nerves, venous drainage with you. So all that stuff came with. So let's say we had a gonadal artery, which we do. It has to go through the inguinal canal to get to the testes to supply it with blood. We also need venous drainage then for several reasons. And you'll notice I'm drawing it really curly and weird. And that's because your gonadal vein for testes is a plexus called the pampiniform plexus. If you need to know it, now you know what I'm talking about. If you don't, I'll put it on the screen. Pampiniform plexus of veins, very close to that artery. Why? Because there's another structure in there carrying sperm, and sperm don't do well with temperature differences, and arteries are hot. So we also have a structure coming up and going like this towards where our urinary bladder would be, and it goes behind it. This is the structure we normally think of when we think of the spermatic cord, because this is the vas deferens, also known as the ductus deferens, that carries sperm from your testes to the prostate gland, the seminal vesicle to get ejaculated, all that jazz is happening through vas deferens. This is how our sperm get to the point where they can be ejaculated and survive. Vas deferens, muscular tube, carries sperm. So that's in our spermatic cord. The gonadal artery and vein are in our spermatic cord. They go by different names depending on which type of gonad you have. And then, of course, we're going to have nerves to innervate these things. So we got several nerves. One nerve that goes through the entire inguinal canal and innervates a muscle made up of one of the muscles of the wall that kind of has become something else when it's in the testes. So our genitofemoral nerve is there. And then we also have another nerve that comes out of the inguinal canal but does not go through the whole thing. Pokes in the side, comes out, called our ilioinguinal nerve. I'm going to cover this all again, but this is just so you can see all of these structures dragged through that inguinal canal, created by the gubernaculum. And it's just, the spermatic cord is just a result of that dragging through those layers of the abdominal wall to get into the scrotum and anchor the testes in the scrotum. So now we have all these other structures that we call the spermatic cord that go through the inguinal canal when you have testes. Different story on this side. Different story because you notice how we dragged all that stuff through, but ovaries typically stay inside the abdomen. So they're not going to be dragged all the way down. Why? That's the gubernaculum's job, is to shorten and drag. So what's happening on our ovary side? Well, what's typically happening, not always, but typically happening on the ovary side is there's also another structure developing called the uterus. And the uterus is developing as the gubernaculum is trying to drag that gonad down. The uterus is also developing.
So in people with ovaries and uteri, the gubernaculum actually attaches itself to the uterus as well as the ovary. So it's not only attached to the ovary like I have it drawn in this picture. I fix it later, but I'm doing the audio over top because I don't fix it for a minute. When it shortens, it can only go so far because of that attachment to the uterus. So the portion connecting to the ovary is going to become known in adults as the ovarian ligament, the proper one. And the portion from the uterus to the labia majora is known as the round ligament of the uterus, a crazy long ligament that connects and supports the uterus by anchoring it into the labia majora. The round ligament of the uterus goes through the entire inguinal canal, which now I'll explain better.
So this is the structure that you can find if the individual has ovaries and a uterus. That is going to be the round ligament of the uterus that goes through the inguinal canal, anchors into the labia majora. Scrotums and labia majora are analogous structures. They are equivalent, equal structures. We'll get to that in pelvis. But the round ligament of the uterus goes through here. Now, what about the artery and vein, the gonadal artery and vein? Well, they don't need to go through the inguinal canal on our ovary side because all they're doing is getting to the ovary. So instead, we're going to see the vein and artery inside the abdomen if you have ovaries in the individual you're dissecting. So the gonadal vein and artery will be called ovarian veins and arteries in this case. They will be in a specific ligament called it has several names. I'm going to use the anatomy name and I'll put the other one on the screen. It's called the suspensory ovarian ligament. If you're surgical, it's called this. So this ovarian or gonadal artery and vein are going to stop inside the body. They never go through the inguinal canal. So it's a lot easier for multiple reasons to find the superficial inguinal ring and the deep inguinal ring if you're looking at a person with testes. If you're looking at a person with ovaries, it's a little harder to find this structure, the inguinal canal, and its rings, because there's not as much stuff going into it. Still possible. And honestly, it's easier to find the deep inguinal ring in a person with ovaries than it is the superficial, in my opinion. One of the shared things these are going to have, though, is that nerve I mentioned that pokes through into the canal midway and comes out. It's called the ilioinguinal nerve. That's one similarity between the two. So on ovary side, we have a round ligament of the uterus coming out of the superficial inguinal ring, and we have the ilioinguinal nerve. On the other side with testes, we're going to have all the things testes need in the spermatic cord going through the entire inguinal canal. And we also have the ilioinguinal nerve. So back to our adult picture, we can see the remnant of the gubernaculum, which is on this side with testes, is your inferior scrotal ligament. On the other side, we can see the remnant of the gubernaculum when you have ovaries, which is the round ligament of the uterus. The shared structure, regardless of what type of gonads you have, that you see coming out of your superficial inguinal ring is going to be the ilioinguinal nerve. What is the ilioinguinal nerve doing here? It's providing innervation to the skin in this area. It already did some motor to the muscles that we're about to talk about, and now it's at the end and it's just doing some skin innervation. Ilioinguinal nerve. What if I don't see these structures? Because honestly, it's really hard to find the round ligament of the uterus. It kind of fans out when it gets to the labia majora. Very difficult to find. It's just a little bit thicker than the other things in that area. If you find it, show everybody. If I can't find my superficial inguinal ring, here's how you do it. I find my external oblique muscle. Fibers go in a hands in pockets direction. When you are external to a friend group, you might see those people and you don't know them, so you're a little nervous. You put your hands in your pockets and you're like, oh, I'm just going to go over here. Hands in pockets direction, external oblique muscle. Now, I was really specific when I said external oblique muscle because we need to cover a concept really quick. That is, a muscle can't attach directly to a bone, correct? We all agree on that? A muscle connects to a bone via a tendon. But in the anterior abdominal wall, we call really flat, wide tendons aponeuroses. So we have a language thing going on here. Aponeurosis equals tendon. So what you're going to hear is the external oblique aponeurosis, which is the tendon of our external oblique, is doing stuff. We're going to cover what stuff it does.
I go off in a completely different direction in the original video and come back to how you find your superficial inguinal ring. So I fixed it for this video, reorganized, but you're going to see things on the next screen that we haven't covered yet. But don't worry, we're going to cover them in the next video. I'm now going to teach you how to find that superficial inguinal ring.
If I take my hand and I find my external oblique and I find the muscle and I line up my hand with the fiber directions of that muscle, so a hands and pockets direction, towards the bottom. So I would be pointing towards the genitals, essentially. I'm going to take my hand, and you must make sure, at first, you must make sure that the Camper's fascia is gone. If you still have Camper's fascia over your symphysis area, that might be why you're not finding it, to be honest. So dissect down a little bit. Be very superficial, but dissect down a little bit. You're just going to run into some cutaneous veins and a few nerves. So take your hand, line it up with the external oblique muscle fibers, and then move your hand down and get onto the aponeurosis. And the aponeurosis, if you look close enough, also has fibers. There's just connective tissue. So we're going to follow this, and what's going to happen is you're going to see those connective tissue fibers suddenly split. So I'm going to use 2 fingers and let them split around it, and what you will find is the opening of your superficial inguinal ring in between your fingers. You might have to take a probe and kind of dig around in between your fingers to find the part that comes up, but you will find, I will guarantee this actually, if you take your hand and follow it down until it splits, you will find the structure. Now we actually name the parts that split. So the external oblique aponeurosis, you're going to see it have a part of it over here and a part of it over here, and the fibers will quite literally kind of like split in 2 different directions. You might see them crisscross a little bit in the middle. And where we see that split, we call the more medial portion of the split the medial crus. So this portion would be the medial crus of the superficial inguinal ring. So it's of the external oblique, really. And this would be the lateral crus, more lateral. And they are the sides of the opening of the inguinal canal. So external oblique aponeurosis is actually most of your inguinal canal.
It makes up the roof of the canal, the top of the tunnel that we showed you before, the sides of the exit or entrance of the tunnel, that's the superficial inguinal ring, and the lateral or external wall of the tunnel. And depending on who you talk to, it also makes up the floor, because the floor, as we discussed in part 1, is made up of the inguinal ligament, which is a thickening of and continuous with the external oblique aponeurosis. Thanks for watching. In the next video, we're finally going to go through the layers of the anterior abdominal wall completely. I'll see you in part 3.